Hi, everybody. Dr. Kogan, GW Center for Integrative Medicine. Thank you for joining the channel. I want to talk about the brand new study that just came out, talking about three particular medications: metformin, fluoxetine, antidepressant, and ivermectin, an antiparasitic drug for prevention of long COVID. So I'm going to go ahead and share my screen and show you this study. So this was a multi-center randomized controlled trial, a very well-designed study, very large study. It's a phase 3, which means that all of this medication has already been proven to be effective for specific conditions. But they're in this model, they're repurposed to see if combination or single medications would decrease risk of long COVID. Now, of course, that long COVID has to be defined. They have, basically created a very specific definition of long COVID, which is probably quite a standard, similar to how we defined it. I do want to highlight the fact that I don't actually know any of these authors, so I haven't contacted anybody just to ask a couple of questions, because there are a couple of issues with the study which I find pretty interesting, and hence I believe that's what explains the results. So let's dive right in. In terms of the analysis of the study, I'm going to make it a little bit bigger, put it on the screen. So as you see, this is a very large study. So they had 1,300 patients who were randomized, and they were followed. Most of the patients were able to follow for more than 9 years. So I think it's quite adequate in terms of the length of follow-up, because the 9 month is, if you're still symptomatic with long COVID at 9 months, I think it's pretty safe to say that you definitely have long COVID. Some definitions are even shorter than that, but that's what they chose. Now, couple of things that are really important. I'm going to drop us to actually the end of the article, where this is a preprint. Sorry, I didn't mention that. What that means is the preprint. It means that the study has not yet been formally, it's accepted, but it has not been formally finalized. So there may be some minor changes at the end, but I don't think they're going to be major. But this is what's called Table 1, baseline characteristics. You want to do two things here. You want to make sure that your placebo matches very well the treatment arm, which I think it is. There's no statistical differences between these groups. But what I want to highlight here particularly is here. Look, so that generally, if you look at overall population, we wouldn't expect that half of our patients would have BMI of over 30. And then the median BMI was almost 30. So it means that more than half of the patients, in essence, were either obese or overweight, and actually probably majority of patients were obese and overweight, even more than 50% by much. So what does that mean? Well, it means that probably most of these patients had some form of insulin resistance, and I think that's what the outcomes are basically based on, and that's really important. So let's go back here for a second, and I'll show you. This is an important flow chart. It kind of shows you what happened in the trial, how many patients they screened. Total persons who were excluded from the trial were over 5,000, and so they included, that's about 20-some%. I think that's very reasonable. That's very typical for high-end, very cool, high-quality study. Now, what you're seeing here, even though they randomized patients in different, very complex formula to look at all three medications, only metformin panned out. Neither ivermectin or fluoxetine had any benefit of any kind. Of course, those of you who've been following my work, I already discussed this previously. Particularly, I want to caution people from not using ivermectin because it's a mitochondrial suppressant, and especially if you're taking it prophylactically, you're depleting your glutathione stores, and you're probably risking a lot more problems than any kind of benefit from this particular medication unless you're using it for an appropriate indication, such as parasitic infection. So group metformin versus placebo, well, you see it's pretty large group, still over 500-600 patients. And there was not a lot of people withdrew. So this was the flow chart show us that the randomization was good, and the final count of patients were quite high. Dropout rates was pretty low. So let's take a look at the data. So they gave us a points of who developed long COVID over breakdowns of in basically 2 months brackets. So they looked at 60 days at the first, and then up to 300 days. So they looked, for, as they said, for pretty long time here. And as you can see, even from the beginning, even at the 2 months mark, there was already significant separation in terms of placebo had a lot more long COVID. Now, it initially was not statistically significant, but it clearly became very statistically significant. And as you can see, by the 9 months, there was 40% reduction in long COVID from 10% to 6%. Now, of course, this was done during the times pre-Omicron, so I want to make sure everybody understand that. I think the current long COVID risk is lower than 10%, but nonetheless, I think what this study does to my practice, it tells me the following. Or the question here is practically, after looking at this, should I be prescribing all of my patients who are overweight, who have acute COVID, metformin? And if I do want to do that, what would be the dosing? So let's look at how they did this in the trial. I just want to read you the actual part of the methods that describes the medication. I'm skipping everything about ivermectin and fluoxetine because I don't think there's any reason to discuss that. But I'm trying to find the here's the procedure. So the metformin dosing was titrated over 6 days, pretty much right after the patients were diagnosed with COVID. So they were given 500 milligram on day 1, 500 milligram twice daily, so 1,000 on day 2, then 500 in the morning, 1,000 at night. So this is a very rapid titration. So basically, and the patients took it for 14 days. So this is important. So this was not a long-term treatment. Now, you could ask me a very reasonable question. Well, if the patients who are overweight, let's say you don't know anything about their sugar status, but should they still be on metformin? Will there be a benefit? That's a very good question. I don't think I have discussed on my YouTube channel whether or not I am pro metformin for longevity or for anti-aging. I think that would be a separate future YouTube, and also the data for that in terms of randomized control trials is pending. There's several trials, but there's no current data, and so I'll tell you how I think about it. But this is a short-term treatment, and I think this is a lot easier to do because the risk of 14 days of metformin is pretty much nil, relatively speaking. Any risks of metformin that could be substantial, like the occasional rare acidosis or high acid in the blood, or things like mitochondrial suppression due to B12 deficiency and some other, complications that are even less common, and allergies, of course, possible for anything. I think those risks are very, very low at 14 days. Now, what is common with metformin and other, with metformin is really the gastrointestinal upset. However, usually it's a self-limiting problem. Some patients will end up not being able to tolerate it, but most people will be fine with that. And actually, it is sort of valuable to take a look at the documented side effects. By the way, if you're interested in looking who contributed, this is a massive group of researchers, so it's all listed down there in the long term, down below and after the references. So there's also interesting that there was they assessed I'll come back to side effects, but they assessed effects of metformin on a variety of different factors. So what kind of dominant it was, actually here they basically said, look, it does look like as if basically Omicron it also worked for. So that's, I think, is important. it clearly worked better for not vaccinated. And of course, we would expect that. People who were vaccinated would have a milder disease to begin with, so it's harder to show any benefit of anything additional on that. So it's expected. Let's see. Oh, and this is if you want to take a look at the separation. So important point here is usually when you have a really effective treatment, you will expect this line continue to separate. So that's a good news. It means that this is probably a real finding. It's not a mistake. It's not a random, and the difference kept getting larger, meaning that you get more benefit as the time passes, not less. So that's a good thing. Okay, I thought that I did see the reported side effects from the drugs, but I guess it's not in the table. Bottom line, there was no real serious side effects from in the metformin group, and I didn't really analyze either ivermectin or fluoxetine because I don't think that that's reasonably interesting at all at this point, given prior studies on this one also. So, in conclusion, should you be taking metformin at the onset of long COVID, at the onset of acute COVID, just in case, so that decreases chances of long COVID? Talk to your doctor. I think personally, my response to this is if you are my patient and you're overweight, I very well could potentially start prescribing metformin titration for a total of 2 weeks, just exactly how they did this in the study. Thank you for watching. Stay tuned until soon. Take care. Bye.